Okay, so good day everyone. This is Nile and this is my case study on cerebral palsy and vaginitis. So without further ado, let's start. Okay. So first, let us first know what is a vaginitis. I mean a cerebral palsy. So this is a condition that affects the movement of the body because of a brain injury. This injury can occur before, during, or after birth but does not evolve or worsen over time. The brain injury that causes cerebral palsy can affect specific functions of the brain such as the movement, coordination, muscle tone, and posture. It can also diminish a person's vision, hearing, speech, eating, and learning. So this brain damage is permanent and uncurable, but it is manageable somehow. Life expectancy is normal or close to normal in mild cases, but it can cause premature aging and stress to the body. The cause of this is that there is damage in the motor cortex of the fetus developing brain, and the damage is sometimes caused by low oxygen levels, poor circulations, infection, and trauma. There are a range of symptoms including muscle weakness, lack of muscle coordination, uncontrolled body movement, and many more. The symptoms can be mild or severe and usually appears in the first 2 years of an infant. Depending on the damage, this affects people in different ways and realms. Okay? People with these conditions may or may not have other conditions such as but not limited to intellectual disability, epilepsy, and delayed growth. So there are four main types of cerebral palsy, and the first type is the spastic, which if your muscles are weak and stiff, this is the type of cerebral palsy, the spastic. And also, the spastic can affect either or both arms or legs, and either the same side or different side, depending on where it is. So the next type is the dyskinetic or the attitoid, which is the muscles move uncontrollably or cause involuntary postures. This is caused by the muscles of the body contracting and relaxing with no coordination. Talking is also difficult when the muscles of the face and the tongue are affected. Just because, as I said earlier, uh, this is caused by the muscles of the body contracting and relaxing. Therefore, if it is in the face, then it could affect talking and communicating because your muscles in the face won't coordinate to each other. The next type is the atoxic, which is the movement is jerky and clumsy, and this can lead to unsteady walking and difficult rapid movement. People with this kind of cerebral palsy can also experience involuntary shaking of the hands. And the last but not the least is the mixed, which is simply a person shows a combination of the aforementioned. So as I said earlier, there is no cure for the cerebral palsy because it is a permanent damage in the brain. But there is an intervention or the way to manage this disorder. So these are the physiotherapists and occupational therapists which can help with everyday tasks such as sitting, walking, dressing, and using the toilet. And physiotherapists may also suggest to put cast, splints, or orthotics in your body. Medicines line Botox, diazepam, or baclofen may help relax and stiff and overreactive muscles. Medicines might be given in tablets, injections, or surgically implanted pumps. And medicines might be needed for epilepsy, pain, sleep, or eating disorder due to cerebral palsy. And special braces to help with muscle imbalance can also be an intervention. And experts can also help with learning, communication, and emotional issues that is common on people with cerebral palsy. So this all of this information can be found in the Health Direct Australia. This is a page of a government agency in Australia which is contains a lot of informative articles, and this is published on July 2021. So the next one is the vaginitis. So what is a vaginitis? So it is an inflammation of the vulva and vagina that can result in discharge, itching, and pain. It is also called vulvaginitis. Symptoms of vaginitis may include itching, irritation, burning, and etc. And you may also notice discomfort when you urinate, pain during intercourse, light bleeding, discharge, and odor with the as an addition to the symptoms. If a person has a vaginal discharge, the characteristic of it might indicate what type of vaginitis they have. So we have actually three types of vaginitis. So a woman can acquire vaginitis when the amount of yeast and bacteria in her vagina gets out of balance. Infection is also a cause of vaginitis. Reduced estrogen levels after menopause and skin disorder can also cause vaginitis. So there are, as I said, there are three common types of vaginitis. These are the bacterial vaginosis, this is the result from an overgrowth of the bacteria found in your vagina, in which bad bacteria starts to outnumber or to beat the amount of good bacteria. The yeast infection is caused by too much Candida albicans, which is a natural fungus in the vagina. And the last one is the trichomoniasis. And this infection comes from a one-celled parasite known as the Trichomonas vaginalis, which is obtained because of sexually transmitted disease or STD. This can be obtained during intercourse, and men with these parasites don't have any symptoms. Though the aforementioned is the common culprit behind most cases, you can also get vaginitis through STDs, HPV, decrease in hormone due to menopause or after you gave birth to a child for girls, and allergic reactions due to lubricant, detergent, and etc. So prevention and treatment. So there are a series of ways that is prevented, and these are: avoid tight clothes, especially in your underwear. Don't use perfume soaps or sprays in your vagina, and use a condom during intercourse. Treatment for vaginitis may differ on what type of it you have. And for instance, if your vaginitis is caused by an allergic reaction, you just need to figure out the problem and eliminate it. Doctors might suggest using a topical cream to help with itching and burning. If it is caused by infections such as yeast infection, then there are medicines that can treat it. And yeast infection can be cured with antifungal medications like fluconazole and suppository or a pill that you insert in your genital area. You can also use clotrimazole, miconazole, and thioconazole. You can also treat vaginosis and trichomoniasis with metronidazole or the flagyl, which is taken in the mouth. And that is all for my presentation of my case study. Hopefully, you learned something new, especially for the short amount of time. And by the way, the article that I based my second topic is from WebMD and mayoclinic.org, which you can visit right here. Thank you very much for watching, and see you again in the next video. Bye-bye!